Hello, I'm Claire.
Why, I'm Anne, and I'm Ben, and we're your dental besties. A podcast which is trying to make dentistry fun.
Mostly.
Not all the time. You look like an Australian surfer.
I'm kind of digging it now.
You actually look good. You actually look good.
Yeah, but the back of my is bald. I look like Dougal from the Magic Roundabout.
I look like a French prawn.
You look like a French prawn.
And I need to make sure you're aware this is not a pair of pants. It is in fact a bra.
Oh, yeah, because that's okay.
Because that's absolutely fine. Oh, dearie me. Okay, so bringing dentistry to you and making it fun.
Always.
Oh, because some people are listening. They have absolutely no idea what we're laughing about right now. This is like a YouTube special.
Yeah, YouTube special. You have to watch on YouTube.
You've got to go to YouTube to see what the heck's just happened here. But basically, we've role reversed. That's why it sounds so odd. Should we get back into our own attire now?
Yeah, let's go. Okay.
That was fun.
That's going to be hilarious. Right, what we're talking about. Inspirational people.
Inspirational people today. I thought we could just have an episode where we talk about the people that kind of inspire us, kind of who we maybe stalk a little bit.
Oh, okay. Insta.
Yeah, something like Insta stalking. And some people that are just like, they've done stuff in our industry or our profession where we've gone, wow, that's pretty good.
Okay. Who's on your mind? Who are you thinking? I've got like 1,000 people coming to my...
Oh, yeah, I've got so many people. And there's going to be so many people as well that are going to be like, why was my name not mentioned? I have to let you know that you're all up there. Everyone who think they should be on that list are on that list, by the way, but we only have like a certain amount of time.
Yeah, we just can't mention everyone.
Yeah. The first one I want to mention, because we mentioned her in a previous podcast episode a couple of episodes ago, but I think she's doing amazing things in therapy, is Kat Edney.
100%. She has really changed therapy and how it's perceived, how therapists can be utilized properly. Yeah.
I love how she's working with practices and how to develop a therapy-led practice.
Yeah.
And everything she does is like pure passion, and like you can just tell that it comes from a really great place.
Because she believes in it.
Yeah, and we spoke about that as well in previous episodes. Like she really does believe in it, and she really drives it, and it's like her life's mission type thing. Yeah, so Kat Edney is definitely up there with people that have changed things in the professions, and I think she's done amazing things for therapy.
Yeah, who do I think's really inspirational? I think one of there's a few, isn't there? So if we're talking about like our friendship group, you've got Faye, who's like
the
EMS queen.
Queen
You've
of EMS.
got Lottie, who's doing amazing stuff on sustainability.
Yep.
You've got Anna, who was the trailblazer for kind of social media.
Yeah,
and
she
getting that
sort
out
of kickstarted that whole like trend of like getting yourself out there, becoming something on social media, like using that to boost direct access.
Christina.
Yeah.
Her own practice.
Yeah. So she started her own direct access.
Who else? I tell you who I love watching on Instagram is Tooth Life Irene.
I know who you mean. Yes.
And Louie, a dog. I think she is doing incredible things.
Mm-hmm.
She's opened up her own practice.
Yeah. She's really big on like systemic health, oral health, blood pressure checks in clinics and stuff like that. So I think,
And I love seeing people develop in the UK, but I love seeing it in other countries because I think we're quite far ahead in the UK and a lot of things.
Yeah.
So then when the ability to run your own practice came in, she was like in there, setting it up. She puts the graft in. She's constantly working. She's clinical at the same time.
Yeah.
So, yeah.
Her social media is actually really interesting to follow as well. She puts a lot of like informational stuff out there.
Yeah.
So I do like following her. Is she Australian? No, she's not Australian. Is she American? She's Canadian, right? So she's Canadian, yeah. I was going to say there's someone in Australia, Emma.
I was going to say...
Emma Talks Teeth. She's got a podcast. In fact, has Irene got a podcast?
I think Irene's got a podcast as well.
Yeah, she's got a podcast.
Irene does about 100,000 things a day.
Yeah. She still only looks really, really young.
Yeah.
That's probably where
She's
she
got
gets
loads
her
of energy. Yeah,
We're like that too old. 87 years old.
ready for retirement.
Yeah. But yeah, Emma Talks Teeth. She's got a podcast, Talk Dental to Me. So
Yeah.
her podcast is a little bit kind of like talking to other professionals. I think hers is quite interview-like, I think. But she works with Curaprox, I believe.
Yeah.
I really like her stories. Like I must watch her stories a lot because her stories are always like the first ones that come up. She must do it a
circulate
lot,
around.
but I think I'll watch them a lot. And she's always like what she does day to day. She does some really fun stuff with her nurses, like funny stuff and some like playful games and stuff. I think her social media is actually really quite fun to watch. She makes being a hygienist look fun.
She does a good job.
She does a great job, and I feel like we need to go over to Australia to go and see her.
Yeah, purely just to see her.
Just to see her and go
And
to
then
Australia.
fly back.
I just want to go to Australia.
Business trip to see Emma.
We're just
and
trying
then
to
fly
find
home.
a way. We're trying to find a way of getting over to Australia, aren't
Yeah,
we? So
anything.
we just need to make friends with Australian people.
Yeah, so if any Australian listeners want us to come do a talk.
Yeah. Or just to come and, I'll just come and shadow you for the day. Just get me to Australia.
It's a long way to shadow.
No, I should tell you someone who I wrote this one down actually because I couldn't remember his name, but there is someone who, whenever I see him writing stuff down on social media, and it's particularly in a specific forum, so Dentist for Dentists, I don't know if you're a member of that.
No, I'm not.
Similar to like the oral hygiene, the oral health, the hygienist and therapist forum, it's like dentists sort of putting their cases forward, like what's the people think about this? And he's called Robert Bates. Robert Bates. He is so knowledgeable. Like whenever he writes, I learn something every single time.
What, like about oral med?
Yeah. So he's like pathology, anything like pathology wise. I've learned so much from him. Like every time I see that he's written something, I'm like, I've got to read that because I know I'm going to learn something. He is fantastic. I don't know the guy.
There are so many people. I'm thinking like, I think my boss is inspirational. Like she's been doing implants. She was like forever. Not forever.
Yeah.
Sorry. She's not really old. But I mean, like she's been
Qualified in
doing implants for a
1983.
long time in probably quite a male dominated area of dentistry.
Especially back in the day.
Yeah, back in the
Yeah.
day. My boss at the Eastman, Sarah, my other boss, Marie at the Eastman. Like, I don't know. I just think they're all inspirational.
Yeah, I'm surrounded by some really you're inspirational, Ben.
Oh, thanks.
You inspire me every day.
Thanks. You inspire
That's why we
me.
Dental Besties. Everyone's like that. Oh, God.
Turn it off. Skip.
Yeah, do you know someone who really helped me with my career was Michaela, Oral B Michaela.
Yeah.
Yeah, she's a fantastic hygienist, and then she now works with Oral B. She worked with Oral B for a long time, and I feel like she's been an amazing support for me. Like, whenever I've had projects and stuff, and she's just been a really great support from Oral B, and then really pushing hygienists in kind of like the limelight in terms of like, how it's always like recommended by dentists. She's like, no, oral health experts. So
Yeah,
she's big on
driving
hygienists
the
and driving that.
profession.
Yeah. Someone called Michelle Hurd. She was really big and pivotal in my career in terms of writing
I've not heard of Michelle
articles.
Hurd.
Yeah, I've worked with her quite a lot, and she's been absolutely pivotal in me sort of getting into the sort of the writing side of my job and getting into writing articles and being published. So yeah, she's been pivotal actually, and getting me in front of the right people at the right time when it came to that. Obviously, FMC for all the articles they put out.
Yeah, and do you know what? I'm going to say one person who technically isn't dentistry, but kind of is. Gemma Barker.
Oh my God, love Gemma Barker. How do we not say
We
Gemma
are like
Barker
Gemma's
first?
fan club.
I'm her fan
But
now.
she is inspirational. She's a
Inspiration.
mum. She really
A business
grafts.
owner. Oh, yeah.
And she is like leading it, I think, in PR. So
Yeah.
big up Gemma.
Big up Gemma and her team.
Yeah.
Because actually
And
there's
all of
people
her
on her
team.
team that like Seb.
Yeah.
Oh, there's so
We're
many-
just going to kind of work our way through the dental profession.
Felicity.
So.
Oh, yeah, we are. Maybe we should like stop
You're
there.
all important.
You're all important. You're all inspirational, and you inspire us every day. And like I say, you learn so much every time I speak to someone new, there's either opportunity in every conversation or there is something inspiring that they've sort of...
That's why I think I like online learning. I think it's really good. But I think courses face-to-face are so important. One, you kind of offload onto one another, don't you? Like, oh, well, I've got that problem. It's a common issue, da, da, da. So you do feel reassured. But it's also just networking, getting to know people. Because... it's so lonely being in that surgery. And I think sometimes online, you get your CPD done, but that's all you take away from it. Whereas courses, I think you take a lot more away. Conferences, like we go to conferences quite a lot. I'm a member of BADT, you're BSDHT.
You're not going to get anywhere by staying in your surgery and doing the same thing day in, day out. I think like getting in front of people and being face-to-face with people, going to the conferences, going to the courses, that's when you get the opportunities, that's when you get the networking, and that's when you really get to know someone. Like I think when I'm delivering a webinar, 9 times out of 10 it's going to be recorded because I like to record my webinars. I'll do it live occasionally, but it's a lot easier to do recordings. So you're seeing like a recording of me. Obviously, when I do the questions at the end, it's always live. But face to face, like there's no hiding, there's no shying away from anything. You can ask me in live time. You get to sort of see my professional side, but then because it's live, my personality comes out. Yeah. So I think definitely going and doing the face-to-face stuff is where you get to really learn about someone and know someone. And then that's inspiring, isn't it? When you get 100%. To know the speaker. And also you get more than just what they're teaching. You're getting sort of like the questions and the sort of the nuances. And
nice lunch.
Nice lunch. We all know that's the most important thing about a course.
Kind of brings us on to... of course.
Oh, because we did say we were going to release the name of it. I then let that slip because it's me. But yeah, of course, let's talk about
So we finally got a name for our courses, which are going to be released very soon.
Yes.
If not already.
Well, we're releasing the courses pretty much alongside the release of the podcast. So we've been very busy bees.
Yes.
The next 2 weeks are going to be mental. But we have the dates and we have the venues.
So we are travelling from London to Belfast to Edinburgh,
Liverpool. Is there Cardiff in there in this batch?
No,
Oxford.
I think we've released Oxford. We're going to release 6 months ahead.
Yeah.
And then, and if closer, maybe in the new year, we'll release the next 6 months.
Yes.
But it's a course just cradle to grave.
So it's women's health from cradle to grave, which I absolutely love. I love that. Basically going through everything from puberty to endometriosis, contraception, IVF, fertility, infertility, pregnancy to menopause. We are talking all things women's health related to oral health. And we're going right from the cradle through to the grave so that you've really got an amazing understanding about how all these things are linked, what that means for their oral health, how it can impact it negatively and positively, I guess, as well.
Yeah, there's some positives.
And how we as clinicians can help our patients navigate that journey, because it is a journey. You know, contraception is going to change things. Menopause, we know, changes things. Yeah. And so let's help you to be really sort of solid in your confidence to be able to have those discussions and also be able to treat those things that come up.
Yeah, and it's on Insta, dental.of course.
Dental.of course, because it's dental, of course.
Yeah.
And I'm, what did we say? Not biofilm bitch. What am I? Biofilm boffin.
You're the biofilm boffin, of course.
And you're the gums guy, of course.
Of course. I'm not going to change my name.
I'm going to definitely be biofilm bitch from now on.
Yeah. You're that bitch.
I'm that bitch, the biofilm bitch. So we'd love you to come along to the courses. I should talk to camera now. We should love you to come over to the courses and look out for them. They're going to be released in the next 2 weeks. And we just really love you to be there.
Come along.
Yeah, come along.
We're going to have limited spaces, aren't we? Because we want to keep it quite intimate.
Yes, because we want it to be intimate so you can get the most out of us. And like we say, we can get the most out of you as well and your experiences. So it's not going to be big, massive conferences. So you need big, massive courses. So you need to get in there fast because we think that they're probably going to sell out pretty quickly. We've had a lot of interest already, even though it's not even been released yet. So get in
It's going to be
quick.
good.
And we're going across the UK so that, we can be as close to you as possible so you're not having to drive too far.
Yeah.
Although Norwich, that area has been quite tricky to sort out, hasn't it?
Yeah, we'll get there.
We'll get there. It'll
Problem
happen.
for another day. What we're talking about.
So I've seen it a lot on the forum, and I felt it was a good one to bring up because I do
Okay.
see it a lot, but we do have to handle it quite sensitively. I'm going to read out the agony on clause. This is just going to go straight in.
Straight into it.
Straight
Yep.
into AAAU. I applied to a dental therapy job on Indeed, and I messaged them to see if they still had the vacancy. And they said that they have a potential place, but they're not currently recruiting UK graduates. To which they first thought they meant fresh graduates, but it turns out they actually meant they were only recruiting overseas dentists. Okay, so it's the overseas dentist topic. What are your reasons? What do you think are the reasons why they only want to recruit overseas dentists? So straight away, I think it's slightly discriminating because surely that should be open to everyone. But they're specifically saying overseas dentists for a therapy job.
I think, firstly, it's a very sensitive topic.
Very sensitive.
I don't know an awful lot about the ins and the outs of it, but I suppose from my experience, I've worked with overseas dentists as hygienists, and I've worked with overseas dentists as nurses, predominantly, in kind of my clinical experience.
Yeah.
I think there is a lot of uncertainty in the profession. I think because we don't know maybe how they've been trained, what they've been trained like. Again, I'm just talking about my experiences, but I worked with an overseas dentist who was working as a nurse, who was waiting for her dental therapy qualification to come through. And cross-infection, I think, was definitely kind of a big red flag for me. It was not... I was a nurse before, so I suppose I was trained a lot in cross-infection, but even in kind of uni, you trained every surface needs wiped down, you need to wipe the fronts of the drawers down, and it was kind of teaching all of that. Now, this dental therapist who was qualified overseas had been working as a nurse for quite a while in the UK. I think there is an ORE for a reason. So the reason is obviously they need to assess the skills before they put them on the register as a dentist. And I think what the associations and a lot of people were concerned with is that if you're a dentist doing a restoration, then it's no different to if you're a dental therapist doing a restoration. You're still doing irreversible kind of damage to the tooth. So why would you need an exam to be a dentist and not an exam for dental therapy? So that's changed, and I do believe now that's closed, but obviously there's a huge backlog of kind of applications going through. So there are going to be these clinicians coming through where there will be a gap in knowledge from the UK graduate to overseas. There is somewhere along the line. That might be a gap in knowledge in a positive way, that they might know a little bit more about something that what our graduates do, or it might be the other way around. From speaking to the overseas dentist who qualified in India, she said that in India it's saturated. Like, there is dentists opening up everywhere. Like, there are so many dentists, and she used to do 12-hour days, like 6-7 days a week, and used to get paid £100 a month.
Oh my gosh.
£100 a month for that many hours. And she said it was constant, like you had to try and sell the treatment to the patient because the patient didn't want to pay for anything. So I can understand why they want to come and work in the UK. And I think it's very much a case of, like, don't hate the player, hate the game. It's not their fault. The system was the system. I think as a profession, we should embrace. We've mentioned this loads of times. We're going to learn from each other. They want to come and work in the UK. They want to kind of have UK culture. That's fine. My concern, and it's a very big concern, is that messages like that, like, they aren't cheap labor. They are clinicians. They have skills. They're registered on the GDC. it should be an equal kind of standing. And I think sometimes what some practices, whether that's independent or corporate, do is kind of encourage overseas dentists to come over and then exploit that. So they will offer less than what they would offer a UK graduate. They'd offer less time than what they'd offer a UK graduate. Maybe offer less mentorship, guidance. And I think it must be incredibly hard to, one, leave your country and come to another country. Two, to leave your country in a place that you trained to do something and come to another country to do something slightly different with so many rules and regulations, which even as a UK graduate we're terrified of, to then have to navigate around that. There might be language barriers, there's cultural kind of differences. And I just worry that they're going to get exploited in the sense of their GDC registration might not mean as much as what a UK registrant might mean. So it's a case of kind of like work until burnout or something happens, and then they'll just get rid and then get someone else in. And I think that is my biggest concern. I have no problem with overseas dentists. I work alongside one at the Eastman. She's brilliant. She's an excellent clinician. She's so knowledgeable. I've learned so much from her. And I think it's kind of, I don't know, protectionist to say like no one's allowed to come in and only UK graduates are allowed to work. Obviously, there's the competition in the job market. But, I mean, we've given plenty of tips on how to stand yourself ahead of other people. And it's just diversifying. But I just, my main concern is a worry for them. For the overseas dentists, that they are going to get exploited. They aren't going to maybe be as valued as what.
And you can almost see how, if that's what they're earning in some of their countries back home with the amount of work that they're doing, how it could look very enticing to come to the UK, and even on the lesser wages potentially, it's still very attractive. But
that's just an example from India. You like overseas dentists isn't just dentists from India; they're dentists from like all over the world. And I think it's the same thing. I think the worry is that it's. Why is it only open to that? And like you say, there's a reason behind why it's only open to overseas dentists, which is what you're worried about, and that is the worry. I've worked, I don't have a lot of experience with working with people waiting for their registration and things, but I did go to an in-house where, which is where we go in and train at a practice, where they had a hygienist who was an overseas dentist, and they had a nurse who was an overseas dentist. He was actually fantastic. Absolutely fantastic. So you are going to get these differences in standards. And he was absolutely brilliant at what he was doing. And I actually said to him, are you going to, when you can, work as a dentist? And he was like, no, he's going to continue as a nurse. He actually preferred it. And I thought that was hats off to him. And he was going on courses. I've been at, like the dentistry shows where I've had people asking about courses because they want to go on courses and learn more about being a hygienist. And I know a few overseas dentists that have stayed as hygienists because they actually being a hygienist actually is really good. In fact, one dentist that came to our practice where I used to work and did a lot of mentoring with one of our oral surgeons. She was an overseas dentist from Libya, I want to say. And she was a hygienist. And she was like, I love being a hygienist so much that I just want to be the best hygienist I can be. And she goes on loads of courses, works alongside perio specialists. And she's just like, I really want to be a very, very good hygienist. Because sometimes hygiene's not a thing. So a hygienist isn't an option in that country. And then to come to the UK and be like, okay, this is what hygiene is. You've got autonomy. This is what you want to do. Then great.
She came in and work shadowed me. She was like, when you get those work shadows that come in and they are like over your shoulder, like watching you move. But she's like, oh my God, this is fantastic.
I have seen a lot of courses now for like that transition. So once you come to the UK, what to expect, what to look out for, how to manage the NHS system.
And that's a very good idea, I think, is if it's going to happen, if it's happening with that kind of like guidance so that it's done well and properly and helps them as much as it helps the practices they're going to and the patients, then that can only be a good thing, because there are going to be differences in how we do things and how they do things.
Absolutely.
Cross-infection control from one country to the next might have different regulations. Like CQC come down hard, don't they? So you've got to make sure that you're reaching those levels. So that's that. That it should come with the territory, shouldn't it? If you're going to come and work as a therapist, you should know how therapists work in the UK, because that's going to be different to, I mean, if we go to America as a hygienist,
then
you can't just automatically.
We'll have to do it all again.
I think in some states you actually have to retrain as a hygienist, because I think some states actually think we're not trained to a high enough standard. So, it's the same for us going to other countries as well. Like, there is a level of we need to make sure that we're reaching the standards that they teach at as well. Yeah. Yeah, it is a sensitive subject. It's not one that I know a lot about.
Especially in the whole, the kind of current climate, with what's going on politically, I think it is a very sensitive subject. I do feel sorry for them. I really do. And I hope people aren't getting exploited.
It's sensitive on both sides, because you can see, you don't want someone to be exploited, and then you also don't want, there not to be opportunities for people that are really good candidates for jobs as well, because that sort of thing going on. It should just
be fair. The whole point, yeah.
The right person for the job.
Yeah, right person for the job. Interview, find the best candidate.
Yeah, agreed.
Really?
Agreed.
I knew you were going to bring up something daunting. Again, this is something that I'd be really interested to hear kind of listeners' views to.
Yeah. Let's open that as a comments thing.
Yeah. Any kind of experiences? Do you kind of agree? Do you disagree? We're all on this learning curve. I don't know. I hope so. I think we need clinicians. We need clinicians in the NHS. And just because the NHS system's broken, we can't rely on kind of paying someone really cheap and expecting them to work really, really hard to save the NHS. It's the system that's broken.
Yeah. Don't hate the player, hate the
game.
I nearly said it the wrong way around there.
Yeah, don't hate the player. Don't hate the player.
Not to have that.
Don't hate the player, hate the game.
Yeah. And it's the system that's broken. So, yeah. And that allows people, you can see how it creates incentives for certain things. And that's, not right. But definitely give us a comment. Tell us your thoughts on this, because there are a lot of people talking about that topic, and you see it on the forum all the time, don't we?
Yeah,
so, what's your thoughts on that? And drop us a comment and a little share. We'd like to hear what your thoughts are, because we don't know everything about it, so we need to know more about it. Do you know what I absolutely loved is our producer when we walked in earlier with you with a wig on.
Oh.
He's giggling away behind the camera over there.
Still laughing at it.
He's still laughing at us.
Do you know what? I think I suit that hair.
I think you should do it.
Well, I can't, but I mean, get a wig.
No, I mean, you can get like extensions.
On what? Skin?
Stick it up.
Glue the wig to my head.
Your beard or your moustache.
I could grow my eyebrows up and job them back.
I'm sweeping. Sweep your eyebrows back over your head. There you go.
That would look good.
Yeah, it looked great. Did you think I suited a tash?
What, now or when you had the draw?
It probably still is there a little bit, because I did have to sprint off, get rid of it, and then come
wipe
back.
it. Oh, that's so funny. We did say we'd make it fun.
Yeah, well, we did say fun, didn't we? We said we're making dentistry fun.
We needed
to
promise.
Be a fun one. If you liked today's episode, then comment and share, and we can do more crazy things for you. Maybe a bit more valuable next time instead of it just being nuts. But yeah, do comment, and share, and we'll see you next time.
Bye.